I left off with last notes talking about bone marrow transplant, and so we're going to continue in the miscellaneous random skeletal system information with the talking about infantile skull. And if you've had a baby in the family recently, you probably know what these are all about. But what happens is the baby skull is not fully developed at birth, which is going to help it go through the birth canal without some damage to either the baby or mom. And so again, those soft spots that babies have in their skull are called fontanelles. And basically there's just fibrous membrane that is existing currently in the skull that will eventually be replaced by bone. And again, the reason for these are just to provide flexibility, because the skull is coming through the birth canal, which is a pretty tight fit, and so kind of helps keep the skull flexible and get it through without causing any damage. It usually takes about 18 to 24 months for these fontanelles to kind of close up and for these bones to start growing together. You can see some pictures here and some pictures of skulls down here at the bottom of those soft spots getting smaller over time. Some of the next few slides are special bone conditions or skeletal conditions. Some of them are a little bit disturbing, and it is of course not my intention to offend anybody or anything, so just keep that in mind. The first one we're going to talk about is cleft palate, which is actually an improper fusion of the upper jaw bones that can happen at birth. Oral surgery, like it's showing there, this girl can have surgery to correct the deformity. Let me just show you what this kind of looks like in a picture. So here's a normal palate, a hard palate, and we'll talk about this bone when we get to the second half, called the palatine bone. Here's a partial cleft palate, still probably going to require some kind of surgery. And then a complete cleft palate, which includes the lip, because of all this tissue being kind of being made at the same time and kind of in conjunction. As you can see in this girl here, the lip is cleft as well. And then just kind of some other pictures, you can see kind of the severity of this. Here, the bone is completely not fused and separated by, it looks like, a couple centimeters there. So obvious problems that can come up with this, as far as like digestion and respiratory problems that can arise. This one more picture for you. And continuing on to spina bifida, which is a kind of another condition that usually is pretty serious and requires surgery to correct the problem, because what happens is basically this is the vertebral column or canal is exposed or outside the body, which obviously this is one of the most important parts of your body, and so this being exposed or damaged, I guess exposed is not the problem, is the possibility of getting damaged, that's the problem. So what happens here are the vertebrae that we'll be studying soon. Vertebrae fail to fuse, and so this tissue just kind of doesn't form correctly. It doesn't really know where to go, so it just kind of protrudes outwards. But again, this is a very serious problem that has to be corrected immediately. Most people with this condition will require the use of crutches and braces and wheelchairs and things, since their nervous system, when they were developing, is not going to develop normally because of those protrusions. You can see it kind of looks like a sore, but this is actually like nervous tissue and fluid that's found in the vertebrae, the vertebral canal. Next one's scoliosis, and this is the unnatural curvature of the spine. This is a sideways curvature. Our spines are curved naturally, but the other direction, and people with scoliosis will still have the normal curvature. If you looked at the sideways view of this, it would still have a somewhat, may have a normal curvature like we all have, but also having this improper sideways curvature. What happens here is this is a degeneration of discs, and we'll talk about those discs again when we get to this next half of the unit. But basically not forming correctly, and so the whole entire spine has some angles to it. In severe cases, could have pretty severe angles to it, 45 degrees or more, which again typically, if that's the case, surgery is required. Here's just give you an idea of the picture and before and after picture. So here you can see X-ray pictures. Can be pretty severe curves, sideways curves to the spine that obviously is not going to be very comfortable and cause these people some problems later in life. Pain being one of them, just general discomfort and just their, I guess their posture and just things normally that we take advantage or take for granted, I guess. Bunions are basically just kind of like inflamed bone in a way. It's just extra bone tissue or bone buildup. There are these little cushions that become inflamed and then harden or calcify with deposits and become bone-like. Here's a picture of arthritis, which we've all heard of this. This is just inflammation of the joints, and there are so many different types of arthritis that we can even begin to talk about many of them, but some ones that are well understood, and we will talk about osteoarthritis for obvious reasons. This is having to do with the cartilage that's getting broken down due to wear and tear. And so wear and tear, you're typically found in the fingers, vertebrae, hips, knees, and wrists are common. You can see a picture of the inflamed or eroded cartilage, worn down cartilage. This would kind of normally be a nice smooth bubbly shape, but you can see you can see some bone tissue in there and stuff, and not making a good joint. This is not a smooth joint. You don't want cartilage that would be worn away. It's causing that joint to work correctly. Rheumatoid arthritis is an autoimmune disease, so the body is attacking itself. It's destroying its own joint capsules. We'll see that when we get to joints in just a little bit. So you can see inflammation, swelling, hardening of the joint, but most obvious are the deformities that take place because of the inflammation, the swelling, and the joints just not working correctly and not taking the same shape as they normally should. Another form of arthritis is gout-induced arthritis. What happens is uric acid starts building up where it shouldn't. Normally it's excreted in the urinary system. So it's a buildup of uric acid in the tissues, and I would have to look it up. I don't know why. It starts in the big toe. I'm sure gravity has something to do with this. And so what happens is the joints here are going to be inflamed and stuff just like you saw in previous pictures, but here they're filled with uric acid. And I'm not up to date with my celebrity news, so this is one of the Hilton girls. You can see here a zoomed in picture of what is supposed to be a gout-induced arthritis. So again, starting in the big toe. Gross, right? Here's some fill in the blanks on your sheet that you should have, your notes that you should have. And this goes back to the regulating calcium levels that I talked about in the previous part of the notes. When calcium levels are low, the parathyroid gland releases PTH, parathyroid hormone, which causes osteoclast cells to break down the bone and release calcium. Remember, they're like kind of cleaning out the bone, cleaning out the skeletal system by just breaking it down. And then when the levels are too high in the blood, again, this is all talking about blood calcium, the levels are too high, the thyroid gland, which are the actually glands, 4 little glands that are attached to the parathyroid gland. Or sorry, the thyroid gland is the big one. The parathyroid glands are the little ones that are attached to it. In any case, the thyroid gland releases calcitonin, the hormone that is going to cause osteoblasts, the builders, to build bone by taking that calcium out of the blood and depositing it into the bones. Going back to the very first unit of the year, this is an example of negative feedback. Again, returning to normal is the way to think about negative feedback, getting back to normal. Alright, we're going to talk about joints and pretty much finish up this part of the notes talking about joints, and there's lots of them. So here we go. The first one we're going to talk about are fibrous joints. And joints are classified based on their movement, and in this case it's kind of ironic because these pretty much allow no movement, and these are the sutures of the skull. So connecting skull bones together, and obviously the skull is pretty much a helmet, so one solid piece, or as much of as close to possible as one solid piece, is the point here. So fibrous joints are connecting bone very close together and not allowing movement between them. At least once the skull is fully formed, right? We talked about the fontanelles earlier. Here's an example of a cartilaginous joint. In this case, hyaline cartilage or fibrocartilage, again, tissues that we've kind of already seen in the tissues unit. There's very limited movement here. There's still some movement, in this case, a little more movement when you in the hips when you talk about childbirth for women. But also you can see these between the vertebrae. The vertebral discs are made of this, and the symphysis pubis, which is down here between the 2 pubic bones, which are these guys here. So again, this is a joint of cartilage which allows very little movement, but a little bit is better than nothing when it comes to childbirth. Which exists in men too. I'm just saying it's a little more important in women. Moving on to synovial joints, and there are a bunch of them, so pay attention. This is going to be a tricky part of the joints section of this test. These are the most common types of joints, and so when you typically think of a joint in your body, you think of something like the elbow, shoulder, knee, and stuff like that. So most common, they allow very free movement. They're covered in hyaline cartilage, so you can see there's hyaline cartilage on both ends of the bone to allow for better movement and to keep the bones from rubbing together. Part of a synovial joint, let me see, first I want to go back. I think you have somewhere in your notes something about synovium. I'm pretty sure I put this in your notes. I should look to see if this is in the right spot. There's your notes. I'm moving off to the side. I just want to make sure we're in the right spot, or you are in the right spot, so I'm not confusing you. Yeah, so right here you should have synovium. Synovium just refers to an egg-like consistency. I'm talking about like raw egg white, before you cook it and it turns white because the proteins are breaking down. So this has the consistency of raw egg white. Synovial fluid is what I'm talking about, which is going to be in this joint between the cartilage, between the bones, and that egg white fluid, synovial fluid, is going to cause a little bit more fluid movement so that there's a lot less friction. So synovium refers to with egg. That's what it means, with egg. So it looks like it's made of egg whites, raw egg whites. Alright, so going back to the joint capsule. So this is kind of like the unit, I guess, of a joint. It's the outer layer of ligaments that are connecting the 2 bones. And then also the inner synovial membrane, which again is this kind of like that lining where the inside of that membrane, deep to that membrane, would be the synovial fluid. So it's secreted from the membrane, and again, that's just for lubrication, to prevent friction from between or inside the joint, between the cartilage, especially between the bones. Meniscus is are shock absorbing pads made out of fibrocartilage, and these are found in the knee. Sometimes you hear people with knee injuries saying they tore their meniscus, so that's what kind of this looks like right here. This is torn meniscus. So again, shock absorbing pads, it's not jumping that does too much damage, but it's the landing that can be damaging to your knee, or just running, landing on your feet over and over millions of times for runners. So you can often see damage to this type of cartilage. Again, it's just preventing the knee parts, which are the two bones and mostly the cartilage, again, from getting too much friction, from damaging those cartilages and eventually possibly damaging the bone. Bursae are actually little fluid-filled sacs that aid in tendon movement. I don't know the really good way to describe this, but here's just a little bit too much fluid. You can see this swollen part of this person's elbow. But in any case, a bursa, which is just one fluid-filled sac, helps the tendon move. I don't know, I guess the way to think about it might be like a water balloon, not filled up too much so that it's distended, but just a water balloon causing things to move a little bit easier because of that fluidity, the fluid inside of that little structure. So we're going to talk about different kinds of synovial joints, and this is where it can get kind of tricky because there's quite a few of them. So the first one we'll talk about is ball and socket joint, which kind of makes sense because it looks exactly like you would think it looks. Pretty simple. This is the case for the humerus and also for the femur. The two large bones, one humerus for your arm and femur for your leg. So there's a head of the bone has the ball shape, and then the socket, which would be just a cup-shaped cavity that the ball fits into. In the case of the femur, it fits into what's called the acetabulum, and for the humerus, it fits into the shoulder at the glenoid cavity. And you can imagine, because you have some of these, the range of movement that is allowed by a ball and socket joint. Take your shoulder, for example, throwing a ball over your head. In other words, an overhead rotation of the joint, which is pretty unnatural and causes some damage. You hear about this with baseball players quite a bit. Next type of synovial joint is a condyloid joint, and this is very similar to the one you just saw, the ball and socket joint, but it's just not as much movement. So you can see it's more oval shaped. If you look at this one over here on the right, kind of like an oval shaped ball which fits into an elliptical shaped cavity. These are found in a lot of places, especially your fingers and wrists. Also would be for your ankles and toes. So these are oval shaped. Condyloid is oval shaped. A gliding joint, which are two basically flat surfaces, which you can see in certain bones within the wrist and within the ankle. Before, when I mentioned the wrist and ankle, I was talking about the wrist articulating with the bones above it, meaning the radius and ulna, and the ankle, which would be articulating with the tibia and fibula. So within the wrist and within the ankle are these joints. Also vertebrae facets, we'll see those when we get to the vertebral column in the next section of this unit. Ribs and sternum, again, we'll see what that's talking about when we get to the next section. So basically these are like sliding or twisting movements. Still pretty free movements, but you can see the limitations here, and especially for these guys, limitations being that they are surrounded by other bones. A hinge joint is a type of synovial joint that you see in like your elbow and your knee, mostly your knee. So pretty simple. It's just a convex surface fitting into a concave surface. Pretty simple picture, and this just allows single plane movement, so bending of your arm, for example. A pivotal joint is a type of synovial joint that allows rotation along an axis. So a pretty good example would be your head rotating, the top two cervical vertebrae, which are called the axis and atlas. But also in another spot that you typically wouldn't think of, which is the two lower arm bones, the radius and ulna, basically right at the elbow. If you rotate your forearm palm up and palm down, this joint is activated. Last one is called a saddle joint. Pretty easy to remember because it looks like a saddle if you've ever seen a horse with a saddle on it. Here would be the saddle fitting on top of the horse. And you see these, not too common, but similar to over here the hinge joint, the concave convex idea. But in this case, it's found in, I guess, a little bit smaller. When you think about the bones of the hand and wrist articulating with each other. So similar to condyloid joint, but a little more freedom. In other words, they can rotate in a little more varying degrees and not just one single plane. And not much, you can only move your finger so many different ways, but you have a little bit more freedom than your elbow. Joint injuries is going to be our next topic. I'm sure many of us have sprained a knee or an ankle or something, elbow maybe. And so just really quickly, this is just a sprain is just the result of ligament damage. And so you can see here the ligaments that hold bones of the foot and are basically the ankle and the leg, lower leg. If they are stretched out, that's called a type 1 sprain, not too much damage, not too bad of an injury. Type 2 sprain, which would be, you can see the ligaments are partially torn. And any part, this is showing halfway through, but just even slightly torn would be a type 2 sprain. And then completely torn would be type 3, so the ligaments are totally disconnected from each other, and this is going to be obviously extreme pain, a lot of swelling, inflammation, and the ligaments basically they're not, the only reason that they're taut is because they're stretched across two surfaces, and so when they're no longer stretched across those surfaces, they basically get kind of mushy, which is kind of gross. Repairing ligaments, completely destroyed, completely torn ligaments, a graft may be used, and that's just, again, transferring tissue from one location to another. Typically, it's within the body. It doesn't have to be from another person. In this case, you can see there in the picture they're taking tendon tissue from the patellar tendon, which is holding the kneecap in place. And then what you can see there, they have some kind of pin or screw here, like holding the joint in place or holding the bones together. And then that graft of tissue is creating a new tendon between those two bones to create that joint again. And this is just the same picture with the kneecap removed, so you can see behind. So this looks like it would be the ACL. So if the ACL is completely torn, this looks like an ACL is being repaired. Another joint injury is dislocation, which we've all heard of. When the bones are forced out of alignment, they are separated from each other. This can happen in the radius from the humerus and the ulna, but another one that's very common is at that shoulder there where the humerus is coming dislocated from its cavity, the glenoid cavity, which is found in the scapula. For something like a dislocated shoulder, pretty easy to put back in place. Some people actually can do it on their own, but most people in a medical facility are trained in this because it is a little more common. But the only problem here is that the ligaments get stretched out. Ligaments that hold these bones together are going to get stretched out, and so it's possible that the joint could be injured again, meaning the shoulder might be separated again or dislocated again. Probably a little bit easier because it's already been stretched out once. Carpal tunnel syndrome, we've all heard of this. It's not fully understood yet, but it's believed to be genetic. But most likely, if you ask me, it's because of inflammation. What happens is you have a better picture in your notes. There's my antivirus being updated. Thank you very much. Let me bring over the picture from your notes, which I think I remember was a little bit better. Here we go. Alright, so basically what happens is there's a ligament here. Zoom in a little bit more. Whoa. Alright, I'm really hoping that's on the center of your screen. Yeah, it should be pretty good. What happens here is, I'm not going to ask you to remember all this stuff, but I think it's interesting because you've heard of it. It's called the transverse carpal ligament right here. That's stretching basically transverse across your wrist. What happens is there are 9 tendons that are going into the hand to control your fingers, and those tendons and the median nerve are all passing underneath this ligament. And so if any of those tendons get inflamed, it's going to pinch that nerve and cause pain to exist on your thumb and first 3 fingers. The median nerve is not innervating the pinky, so you would experience pain on these 4 fingers here because that nerve is getting pinched, most likely because of an inflamed tendon being overused. And if you're sitting at a keyboard, you probably have the little flip out things on the back of your keyboard that cause the keyboard to raise up. So you can imagine your hand being raised up with that elevated keyboard, and that's supposed to relieve some of the pressure put on these tendons to alleviate carpal tunnel syndrome from happening while you are typing at the keyboard. Just a couple extra things just to finish up on. Scoliosis, we kind of already talked about that. But vestigial tails, if you've ever seen Shallow Hal, that thing wasn't real, but they can exist. Tails are supposed to disappear before we are born, and sometimes they don't. Cracking your knuckles, some people usually ask about this. It's just basically bubbles, little air bubbles that are being popped. And we're going to start our next set of notes talking about the vertebrae. So there's your preview.